be part two of our, this is going to be part two of our fire discussion. We thought the fire service would be a great topic for scale because we've seen a lot of changes in Minnesota, especially in Scott County over the last couple of years. And a quick internet search shows that 9 communities have transitioned to some form of career fire service since 2018. 3 of those being in Scott County: Savage, Shakopee, and Prior Lake. Despite those numbers, or despite those changes, Minnesota is still a heavy paid on call volunteer state. And we rank 48th in the nation for household spending on fire. So despite all of our talk about increase in costs, we're really towards the bottom of the United States in our investment into the fire industry. On average, in the United States, it's $497 that each household spends on fire protection. And when I say fire protection, I'm not talking smoke detectors. I'm talking about the fire district, volunteer, or just a fire department, a local fire department. In Minnesota, we spend $280, so we're quite a ways back. Last month, we heard from Chief Bresnahan and Assistant Chief Rees about the rising cost of fire service, equipment, staffing, et cetera, and then also the increase in calls for service regardless of population or growth. I think that's one of the themes that we heard from last month is you would think that there would be a correlation between growth and population in these calls for service. And what we're really seeing is that calls for service are increasing quite a bit despite that. So today we're going to provide some context to those numbers and talk about what's working well, what could we be doing better, and what's the path we need to take to get there. So we've asked 3 fire chiefs and 1 Brave City administrator to speak with us about what's happening in their departments and provide some context here. So first, I will start with introductions. Let's start on the far side. Tom, do you want to start?
Tom Terry, I'm the city administrator for the city of Elko New Market.
And then can you guys talk about how long you've been with your organization as well?
So I've been with the city of Elko New Market prior to the merger. So I've been with the organization for over 20 years. Prior to that, I worked for the city of Norwood Young America. So I have spent close to 30 years working in small towns with paid on call fire departments.
Jeremy Bresnahan, Savage Fire Chief. I've been with the city of Savage for 5 years, starting as an assistant chief and then promoted to fire chief. And I have 17 years of full-time experience in the North Metro in Anoka County, and then 3 years of paid on call service.
Steve Rinda, New Prague Fire Chief for the last 5 years. Been on the department for 21 years.
Rick Steinhaus, Fire Chief, Prior Lake. Trying to think here. So 33 years in Prior Lake, 10 years as the chief full-time. So paid on call for the rest of that time. So then I spent 11 years in Burnsville as a fire captain before moving to this job.
Thank you very much. So we're going to go through a couple of questions here. I'm going to ask the panel. We'll also leave some time for the group to ask questions of the panel as well. So first, I'm going to start with staffing and workforce trends. And the question is, has the typical recruit at your department changed over the past 10 years? And where do you see the fire service heading in terms of workforce and recruitment? Tom, do you want to start us off?
Yeah. We currently are authorized at 30 firefighters. Our historical staffing has been right around 27. We're currently at 30. Overall, what I've seen the trends in recruiting is we've been lucky enough to be able to get firefighters. In fact, when we went out earlier this year for firefighters, it was the largest pool of applicants we've ever had. I think there are a couple of factors to that. As a growing community, we have people that move into the community, so they have a desire to want to become engaged in the community. The fire service is one of those ways. Another item that we suspect but have no way to truly measure it is we are in the top 6 communities, I believe, in the state with regards to the pension level that we provide. And while I have yet to have more than, I think, 2 applicants bring up financial aspects, everybody that applies for the fire service wants to be in the movie Backdraft, where the house is exploding behind them as they got a cat in one hand and carrying out a small child in the other. But 3 years into it, when it's 20 below and you're putting out a pig barn fire and standing in 18 inches of water, for 5 hours, that's when the pension kicks in. I do have to say that we do see some changes though in the nature of the applicants. And I think it's the societal changes that are across the board. Everybody's lives aren't centered in town anymore. Extracurricular activities for families are substantially more, those time commitments, and it's running into the time commitment for the fire service. And those time commitments, and the chiefs can speak better to it, have grown over the years. The amount of training that they have to go through on an annual basis, the training they have to go through just to simply be required as a firefighter, those are really strong demands, and they are competing against the other demands in those individuals' lives. We've been lucky, but I believe the chiefs will be able to speak to challenges they're finding, not so, even so much with recruitment, but with retention of firefighters.
Perfect. Good morning. So for the city of Savage right now, just to put some data to this. So we're seeing a drop in community volunteerism. I think many city organizations are seeing this. I think in our community with the demand going up, it's an additional demand on our part-time firefighters. So specifically, 90% of our part-time firefighters leave within 3 years. So we only get to use them in operational capacity for less than a year, for the pure fact it takes that long to onboard them with training. So really a significant amount of investment for 90% of them not to last longer than 3 years. 1 minute. The city of Savage, I think when I first got there, we're allocated up to 40 part-time firefighters. Within a year and a half, we reduced that to 25. We just reduced that to 20, and I'll be surprised if we can even sustain 15 here over the next year.
I remember when I started as administrator, our relief association, the whole board was made up of 20-year firefighters. And today we have two that have been with us for 10 years, and the rest are like 2 and 3 year
Yeah.
folks. And our relief association voted to dissolve earlier this year. So the benefit is going to para instead of through the relief association. Chief Rinda, what are you seeing?
So in New Prague, we are seeing our applicants drop. We used to get 10 to 12 applicants every hiring cycle. We're getting 2 to 3. We are still lucky we're still getting good applicants, so we are hiring good people. We are getting most of our applicants that are still working in the community, so we're still getting some good daytime response, which is good for us. We're just not getting the amount. We're also seeing, when I got on, there was a lot of 20-year plus people that everyone stayed 20 years to get their full pension. And we're seeing a lot of people leaving before 10 or right around 10 or at 10. The 20 to 25 has kind of turned into the 10 to 15, I think. We do, 20 years ago, we probably had half our department that was 20 years, and now there's 4 of us, I think. So we're definitely seeing a trend. I think it's just society in a whole is people are busier and just can't juggle all the commitments. And there is a bigger commitment to the fire service than there was 20 years ago.
Thank you. Chief Steinhaus, what are you seeing?
So if I think back, we were always able to hire 50. We had a number of 50 that in my 20 plus years, we never saw that number paid on call wise. So we started to see a trend go from pretty level as far as the hiring of paid on call firefighters was. So we could see as many as 15 to 20 applicants for 4 or 5 spots, and we would get those people. They would go through the process and go through the academies and move into the department pretty easily. What we started to see though was that trend was starting to fall off as far as once the time commitment started, how long they could stay. So we would have people that would make it 6 months and they would leave, a year and they would leave because of the time commitment. So we started to see 10, 15, 20 applicants. the last time we hired a paid on call firefighter that didn't already have fire experience, and I'll get to that in a second, we had no applicants. I think one year we had one. So, that was a big trend, but it was a kind of a cliff. It just fell off. So, we actually switched now to, our full-time staff, but we're supplemented by, paid on call firefighters part-time now. We only hire, experienced firefighters. So we got rid of our residency requirement, and we have firefighters from other cities that want to do more part-time work. So, that's what we ended up having to do just to make things last, and it's working well. And I hope that continues.
Thanks, Chief. Did you have something to add, Tom?
I think going to the change in society and the nature of longevity, which is an issue in a lot of communities, this is my perception. That one, if I look at the communities I worked in and even our community, and I go back 20 years, there wasn't a financial incentive to serve on the fire department. There was a small amount of something that kind of made it worth it, but people were doing it purely to give back to the community. It was that philanthropical kind of motivation, the brotherhood of the fire service. I'll be honest, I believe the culture within the fire service has changed. And because of those competing demands on time, I think it's more of the financial considerations, while not the primary driver, have increased in level of importance with regards to that cost benefit analysis that individuals have to do.
Thanks, Tom. Now just making it more of a broad question, how have you seen the fire industry change in your organization over the last 10 to 15 years? My question is really beyond staffing. Are certain calls becoming more frequent? I think we saw last month that calls are increasing, but are certain types of calls increasing? Are the expectations of the public changing? Is not just staffing levels, but the type of person you're getting changes? Jeremy, I'll let you start this one.
Yeah, so the role of the fire department, I think over the last 10 years has changed because we're fully embracing the usually 5 to 6 responsibilities of the fire service. Again, like we said the last time, we do a poor job of marketing our service, right? We're doing hazardous material, doing technical rescue, medical, fire. Some of us are doing emergency management. I see that growing because of the density within our communities. The demographics are changing, the diversity is changing, and all that brings in complexity. Also with going from a developing to a redeveloping community, right? Developing communities, we're building occupancies in buildings built for that purpose. Now we're going to redeveloping buildings. We're starting to chop that building up, subdivide it, and we're now putting operations in that building that was never meant for. So I see that. And then also along with the diversity and the complexity, right? We're dealing with a lot of different backgrounds, immigrants that weren't blessed with the education that we all received through K through 12 and the safety aspects and what that service is. They didn't receive it, so they don't understand it. So now the fire service has come into a all hazards response model. So I see that's where the calls are driving, the complexity is driving, and then our responsibilities are growing. So.
Thank you. Chief Rinda, what do you think?
So I would agree with what Chief Bresnahan said. 20 years ago, calling 911 was an emergency. Now calling 911 is convenience, which is okay. We're in the customer service business and we want to be good customer service people, which leads to a higher call volume, which leads to some calls that, we never would have went on 20 years ago that we're going on quite frequently now. And some of these calls we're expected to be professionals at that, quite frankly, in the volunteer model, paid on call model, you're just not going to be a professional at.
Yeah. Chief Steinhaus, how have you seen changes?
I think if you go back to some of our previous presentations here, it's pretty obvious that our communities are growing very quickly. So I think, going on what Chief Bresnahan and Chief Rinda said both, but if you add the amount of people that are coming into our county and our communities, that just adds, more people, more problems, right? So some of those problems, like Chief Rinda said, aren't necessarily something that we can help them with, but for the most part, when you have the communities growing as fast as they are, then you're going to see that. I think one of the things we talked about in our meeting prior to this was our communities are getting older. So we're seeing a lot of senior high-rise developments, 55 plus communities, condo communities, and so on, townhouse communities. So that also is driving a lot of what we do. When you go back to that, you see, our EMS service being taxed with more and more calls because of that. And so they're falling off. Alina, Midwacaton Emergency Services, the transporting services are getting bombarded with calls. So now we're being called to assist them as well. So.
Very good. Thank you. Tom, do you have anything to add?
No, just really to reinforce in a community like ours, call load has increased beyond the growth in population, and it's increased largely across the board. But we are seeing that we're providing increased support to EMS, ambulance services. They're becoming more challenged. They have the same staffing issues. Their response times are longer. And so our firefighters are being asked to fill that gap.
Yeah, and just to spin off of Administrator Terry and Chief, the medicals are, one of the calls that is growing, they're all growing, right? But the medicals are growing. The private transport agency is under a lot of pressure as they're having resources and staffing issues. What that's doing though, it's driving up our budgets because it's now drawing up police and fire in their hour utilization on that scene time. So if we're waiting 20 to 30 minutes for a transport, that's 20, 30 minutes longer our fire and police are on. Then we have overlapping calls. Now we're striking all calls or asking for additional resources because our crews are tied up longer. Also, we're also leaving that gap waiting that long for patient outcomes. We can't sit and watch patients suffer for 20 minutes or 30 minutes and decrease their outcomes just because we're waiting for a transporting facility or agency.
Chief, what's Savage's percent of overlapping calls?
So right now we are at, I think, 1,300 calls, if not 1,400 calls for the year. I'm going to ballpark it. I think there's about 300 calls or 300 times we've had 2 calls running simultaneously. Then we've had 3 overlapping calls and 4 overlapping calls that we've experienced this year alone. So we're sitting probably, we bounce because it's year to date. So it's either 10 to 13 to 15% of our calls are overlapping in some capacity.
That's what I was going to say. I thought I recalled you saying that we're between 10 and 13% of overlapping calls. So 1 out of 10 calls, we have staff already out there. We're getting another call. We're going to potentially need to request help from Prior Lake or someone else if we don't have the staff there, depending on what the types of calls are.
Yep, because the reality right now, the 4 communities, the 4 North Scott County communities, we only have 1 staffed unit in any one of those cities. After 1 call, you actually can start talking. This is almost a mass casualty incident or something we have to triage. We go on 1 call, I need to look at Prior Lake or somebody else to come in and help, or I have to strike an all call, which tones out all of our off-duty full-time firefighters, all of our paid-on-call firefighters, and they all come flooding in because I don't know what to expect. That's a huge budgetary impact on our overtime and our staffing costs.
All right, thank you. So next question is on technology, indoor equipment needs, or maybe just other services in your department. So can you talk about how advancements in equipment, data, technology are changing your department's capabilities? Or another question you could ask yourself or answer here is, what investments in your department are becoming essential? So Steve, I'll let you start this one.
Let's see here. So I think, as far as advancements in equipment, all of our equipment costs 3 times more than it did 20 years ago. So that is a budgetary issue for us. I think the equipment we need, we're definitely needing more medical equipment. We're carrying more AEDs, more Lucas devices, more things of that nature than we did 20 years ago. And of, everything costs more. A radio that was $3,000 is now $6,000. And that happened in the last 10 years. So I think from a budgetary standpoint, everything that we need to do our job has cost double in the last 10 years.
Yeah. Chief?
Yeah, a lot of our technology, going off what Steve said, the amount of equipment, fire-wise, operational-wise, is obviously, the needed equipment is frankly expensive, right? And, that's, like everything else. So, but what we're also seeing is the amount of technology advancements in our service, and not just Prior Lake, just broadly, when you look at, we all are switching to a reporting platform, changing how we do that. So, but that platform includes pre-planning software and inspection software, EMS platforms, fire incident reporting, all kinds of tools that we need. And it's one of those things that I looked at when we were all kind of investigating this as a group, that you can't just get one piece of the pie, right? And that's where it gets to be on the spendy side of the budget. Each platform, I wish I would have invented this long ago. So each part of that platform costs X amount. And as you add the pieces of the pie, it gets more and more and more. And so, so we're there with that, but just the advancements in the technology, drone programs and software programs and, personnel programs, all of it, really is.
And then they charge you to integrate one software to another software, and then they discontinue the model that you're working on. You got to upgrade to the new model.
My favorite is when you leave a platform, you have to pay that platform to transfer your service to the new platform that charges you to bring that stuff over.
Yep.
So, yeah.
Yep. They figured it out.
Yeah.
Tom, what are you seeing in Elko?
Yes.
Equipment, technology, things. What do you see changing? And not even just like technology, equipment, like services. Are there certain types of services that are becoming essential to the fire industry?
So as a paid on-call agency, even our command staff are just regular folks who generally work or, that work or live in the community. As we continue to grow as a community, we have increasing demands for fire marshal services, all those specialized areas of the fire services that as a paid on-call department, we don't have that internal expertise to be able to provide. There's a great culture in the fire service from the community, and, we can drop a dime to, Savage to get some feedback and advice. But the reality is that there are certain things that we just kind of bumble our way through to a certain extent. We do our best with the resources we have. And as we continue to grow and as the nature of things become more complex, we have an increasing demand for those services, and it's moving beyond being able to get a little help from our neighbors to where we need to have more dedicated resources and time. And there's a cost to that.
Yeah, for advancements and necessities, I kind of broke it down to the 3 sections that you're requesting. For equipment, right, it's improving our safety. This is why NFPA exists. This is why OSHA exists. They're constantly updating the standards, which drives updating into our protective equipment. Our vehicles, yes, it increases safety, but as usual, it also increases the cost.
Drives the cost too. That's what I was thinking.
Yep. And then equipment, I forgot which chief brought it up. Lucas tools. This is the thing that creates or does automated compressions during CPR. That's a $20,000 piece of equipment. But what we're seeing is additional equipment to provide better patient outcomes because we have such a delay and this impact waiting for that ALS service. Data, right? We need to, it is critical to make sure we have good data, right? This is what's driving us in the city of Savage to make strategic planning decisions. You know, it's helping me deliver better operations, more fiscally responsible, managing our staff time where it's appropriate, where I'm trying to manage the burnout. Inventory management. The inventory that we have in our fire stations is really expensive. To the Band-Aids, to the big trucks, it all starts adding up. We use a lot of data to drive that. The budget management. Really, technology is crucial, especially in computer-aided dispatching. And I know the county is working with the public safety teams right now. Our profession's moving so fast, right? And we're getting called to these complex calls for service where we're going to something that's a rare call, but the risk level is so high and we only have so much time to make that decision. And then on top of that, the ability to talk with our law enforcement partners in real time and with our ambulance service. It's 3 legs to delivering effective public safety services, right? That computer aided dispatching and those dispatching support, it is crucial to the service that we provide our communities. And if we're to really look at that, we are doing a regional response in our fire service. We just do it through a mutual aid package currently. It is not abnormal for Savage to go over to Burnsville, right, into Dakota County. That's all driven through computer-aided dispatching a lot of times, or the software that we're using. We're sharing each other's information because we know we're using each other's resources so often. The best practice, right, is to develop a service that can handle 90% of your city's calls and then rely on the 10% for your mutual aid and your other agreements. That's fiscally responsible. And you're delivering consistency to your community. I think we're well below the 90% right now, especially with only the 1 staffed unit in each community. But again, technology is crucial to us delivering that service and making those decisions in real time.
What about employee wellness? Are you all investing in employee wellness for your employees differently than you had been 5 or 10 years ago? I'll just open it up for folks.
Yeah, so the community of Savage and our city council and our community is truly vested in the health and wellness of our firefighters. We not only track carcinogen exposures, traumatic exposures. The city is also invested in embedded mental health counselor to actually be in the fire station 15 hours a month with our firefighters. Because the reality is this, is we need to get ahead of the mental health aspect to our public safety employees, right? We need to give them the tools and the real-time support so it doesn't become PTSD. It doesn't become a disorder. Let's manage the post-traumatic stress, but we can manage the disorder part. So we have taken some huge strides. And then if anybody has never heard, we have a CERT K9, Marshall. He's pretty popular around town. And again, that is really to support our firefighters, secondary to public education and how we deliver that to our community.
Other folks?
Yeah, I think a lot of our stuff is just the, we have programs out there. MinFire is a big one for us that we use pretty regularly and that's everything from cancer awareness, mental health, cardiac awareness. So just the general health of our firefighters.
Addiction.
I'm sorry?
Addiction.
Yeah. So a lot of that stuff that the unfortunate stuff that we don't like to talk about is still a thing, but just coming down from tracking our PPE use, the equipment in the stations for washing that stuff and deconning it. We have a bathroom remodel coming up at our fire station that, bear with me here, involves steam showers. So some of that studies have shown the steam showering after a fire can greatly reduce the carcinogens in our firefighters. So something we invested in and so we're moving forward with that. So
The other thing I had seen that I thought was interesting, I think is good, and I think most on the panel is doing is the psychological exams before hiring. You guys are doing that, right?
Yeah, I think you're seeing the fire service really fall into line with the law enforcement service, with the tragic events that unfolded earlier this year with our legislators, right? Like, we need to be that much more diligent of how we vet our employees. Part of that process is sending them through a psych evaluation. Right? We need to have a further understanding before we put them in a uniform. Our community gives you implicit trust at a visual, right? I come in my street clothes, you're not letting me in the door. Put a uniform on me, I'm pretty sure you're gonna let me in the door. But we need to really make sure we're vetting that we're getting the highest quality person to deliver that service to our communities.
And there's a loss control element to it, in addition to not putting somebody in a position where they may potentially have long-term issues or potentially
Mhm.
fail. You want to make sure
That's a good
that
point.
as an employer, you're not hiring somebody that ultimately is going to result in not only issues with them and their performance, but also the costs associated with somebody that is more susceptible to developing PTSD or other mental health issues just because of the demands of the position. So two sides of the coin.
Yeah. So looking ahead, 5, 10 years down the road, this is the magic wand question. If you had a magic wand, where would you see the department in 5 to 10 years in your community? And I understand we have different types of communities here, so I kind of expect different answers. But if you had perfect 2020 vision into the future, what do you think your department looks like, and how is it different? And Chief Steinhaus, will let you start.
A different chief. No, I think, you know, what we look at in our strategic planning, whether it's with our city council or, with our, with my staff, just in general, you know, our biggest thing is the staffing side of things is a big question for us. We could talk about that for days and years, so I won't bore you with that, but staffing is a big one for us. Budgetary constraints, we just talked kind of about that quite a bit here. Budgetary constraints as far as equipment. You know, one of the things that I failed to say before was some of this equipment is required. I think Chief Bresnahan touched on that. Some of this equipment is required by, you know, NFPA or state requirements. So, you know, in the perfect world, I would love to see, you know, fully staffed stations and all the latest and greatest equipment, but we know that that's not necessarily a perfect plan. So the magic wand, that's the magic wand part of things. But I think it's very important to say that we do take all the, you know, take that planning, that strategic planning very seriously in our department. And I know everyone does in their department. So, you know, that's the magic wand. Yes. But realistically, it's a work in progress. So,
Yeah.
and we do that every day. So,
Yeah. Tom?
I think I would expand our time horizon beyond 5 to 10 years. I think our general operations are relatively stable within that time frame. But here's the reality: as you become bigger and your call volume increases, your need to be able to have firefighter availability starts to drive the needs to start looking at full-time staffing, whether it's core command staff, stretching out ultimately to full-time duty crews. I think that's going to be, for the smaller communities, the long-term trend. The other thing we have to keep in mind is on that command staff level, if you have a fire department, you're hoping that you have somebody who is on the department that is readily available, that has the aptitudes and the desire to be able to put in that extra time to serve as the chief, the assistant chief, your captains, your lieutenants within the department. And when you're in a smaller community, that pool is only so big. And so I see the long-term, the challenge for smaller communities, but also the long-term trend is we will eventually follow the way of our northern partners and have to start looking at more full-time staffing. Coralco New Market, I don't think that's on the immediate horizon, but it is an inevitability for us at some point down the road.
For the city of Savage, I think the next 10 years, you're going to see a continuation of the staffing model to continue to evolve. I think the writing's on the wall that we will be transitioning at some point in time sooner than later to a completely career service. The biggest one I think that we need to look at that 10-year mark is expanding our operation to possible EMS transport services. It provides a better patient outcome. It drops our hour utilization of all of our public safety entities that are on scene. And then there is a tool there that there is a possible cost offset to your operations for your staffing costs. So long-term, I do see that as a discussion for the community of Savage.
Steve, where do you see New Prague?
Well, beautiful rural New Prague, I would see our next 5 to 10 years. I would think that we would probably need to move to a full-time chief / fire inspector combination. And this is not me jonesing for a new job, that's for sure. I'm probably with Rick as far as getting a new chief.
I can talk you right out of it.
Yeah. It's getting really hard to run a department and have a family and run a business at the same time. The time constraint is just more and more every year. So I could see New Prague having to go to something like that to start. Our call volume is increasing, not increasing to the point of full-time staff in the next 5 to 10 years. Look out farther than that, maybe, depending upon development, but I would say in the next 5 to 10 years, we'd probably be looking at starting the conversations about getting a full-time chief in our department.
Interesting. Thank you. So we've talked about technology a little bit and the rising cost of equipment. So there are certain types of equipment we're required to have. Growing staff. So in the spirit of scale, trying to be more efficient, and I'll just open this up to the group. Are there areas, do you think, that are ripe for collaboration?
Sorry, can you repeat the question?
Are there areas in the fire
Sorry.
in the fire industry in Scott County that you think are ripe for collaboration in the spirit of scale here?
Well, I think we do a good job currently with training our new members together. And I think we have the person a couple people that are running it are probably getting close to the end of that. So I think that's a good spot for collaboration, is to continue the training of our new members. I think in continuing to build out our mutual aid and auto aid partners is good. It's going to be good for New Prague. We're working on it currently. I know the northern side is already doing it, but that'll be good for the New Prague side of it.
Can you guys explain what it means to build out the mutual aid?
Well, and I don't want to misrepresent. Our mutual aid is built out to its capacity, right? Like, we only have so many resources within Scott County. And we just recently, I think in 2024, all of the communities signed off on an updated mutual aid agreement, right? That provides a known capacity that apparatus can respond with, and a minimum amount of staffing, and what is that educational level that we require. After the initial response of your first unit, there's not much more capacity left. And it's just stragglers. Now we're going to start pulling in from different counties. We just recently had the Cargill fire. We had units from Hennepin County. We had units from Scott County. We had units from Dakota County. The reality is this is just the funding, as Brad has pointed out at the very beginning of this discussion, we're 48th out of 50, right? And as the school district pointed out, and as our cities know, staffing is a huge part of our budgets, right? That's the cost. We have fully implemented and built out that mutual aid to its fullest extent.
Any other areas for collaboration?
Yep. I think there is a strong opportunity for an overarching joint powers agreement, right? I think right now I've had the honor to work with the fire chiefs in Scott County for the last 4 years. When I took the chief's role in Savage, I was right away put in as the chair for that group. The challenge with it, it's not an organized group, it's an ad hoc group. There's good intent with that meeting, but there's inconsistency. The JPA will actually finally, or hopefully, set some really good guidance to the structure, its operation, its expectations, and then to have it where it can be built out to where it can be built upon, right? It doesn't have to be a huge undertaking, but I think it walks us into the 10-year vision of what does a taxing district look like? So I think low-hanging fruit, something we can really sink our teeth in, is a further discussion on the creation of an overarching JPA.
Very good. Anything else? Tom, did you have anything?
This is just kind of an echo of things that have been mentioned earlier, but I think it's fair to point out that while Chief Bresnahan raises a lot of good points, what collaboration looks like looks different depending on the community, right? There are different operational opportunities for collaboration on the northern portion of the county just because of density and proximity. That looks different in the southern portion of the county where you have barriers of geography and distance. But I still think there are opportunities right out of the gate. Was mentioned a couple times. Fire inspection services, fire marshal services. That's a need within the community that for a lot of the smaller communities, we cannot support individually. New firefighter training. We've had the luxury of having a program that's been in place for a very long time where we've been able to, but the resource, primarily instruction resource for that, is going away. And so I think there's opportunities to look at how we're going to meet that need for training of our new firefighters going forward. So I think even depending the scale, I think there are opportunities for collaboration within the community where, one, I think we have to be willing to do it. Two, we have to be a little less territorial and a little bit more open-minded. And we have to also recognize that fire service may look differently in different communities. It's not a one-size-fits-all type of operation.
Excellent point.
I got one more thing, Brad, just a call to action, right? If we're noticing that we're 48th out of 50, we know that there's just going to be this huge financial impact. What I would encourage us to do is to make sure we're reaching out to our state legislators to what are those opportunities similar to that the law enforcement gets for ways to offset those costs. The unique thing about the fire service is this. In law enforcement, you have multiple levels of service, whether it's from federal to state to county to your municipal level. All you have for the fire service is the municipal level. So when we have state level incidents, it's the municipal fire departments that are supporting sometimes state operations. And if it's growing, I would go, hey, let's get in front of our legislators, leverage the League of Minnesota Cities to, in that future, what are ways that we can get some support from the state level entity?
Yeah, that's a very good point. Tom, one more.
One last point. I'd like to throw out to the group the idea that, and Chief Bresnahan just, what did you call it? You called it the fire service?
Yeah.
What percentage of your calls are actually putting out fires?
I knew you were going to ask this question. So actually, for just speaking for the community of Savage, right now we're at about 3.8% of our total call volume for active fire suppression. We're at about 15% for alarms. So if you're to look at that, putting the wet stuff on the red stuff, 3 to 4% of the time. Fire-related calls, right, are up there. So in total, you're looking at 17% of our call volume.
So I think what we're really looking at is we maybe a rebranding, not just for officials, but for the public of what it is. It's really emergency services. I have in my career had many conversations with members of the public, elected and appointed officials, and they talk about we make so much investment to put out,
The barn fire.
the barn fire or X number of calls, a year, not realizing that in most communities, 70 to 80% of what we do is medical and rescue related services. So I'm just throwing that out for the group that as you're having discussions internally that we're not talking about fire services, we're talking about emergency services.
Very good. Thank you, you guys. We have about 5 to 7 minutes for questions from the group, so I'll open it up if there's any questions.
First of all, thank you very, very much. This was incredibly informative and very educational for me, as I'm sure it was for others. And also thank you for your service. Thank you very, very much for your dedication to our communities. I had a question. I had a lot of questions actually, but I'll start with one of them about staffing. Chief Steinhaus, you mentioned that Prior Lake expanded their staffing opportunities to non-residents. Is that something that other municipalities and cities have also done?
I can't speak for everyone, but I do know that there are a lot of communities out there now that have gone to that model for that very reason. The true part-time model, it used to be volunteer, paid on call, whatever you wanted to call them. The true part-time model, I think, is starting to take hold in multiple places. I know Hennepin County does a lot of that. So it's new for us, but it seemed to be the only way we could get people in to stay.
You guys talk about the difference between paid on call where they come to the station when there's a call versus part-time?
Yeah, so paid on call, that model, they're wearing a pager like this. They're doctors and mechanics and teachers, and they come from their jobs, they come from their homes when that pager goes off. The part-time side of things is where they're actually in the station working shift hours, whether it's an 8-hour shift, a 4-hour shift, a 16-hour shift, whatever that is. And then they go home and go about their normal business, and they sign up, come back for the next one.
So the paid on call where they have to come when there's a call, there's usually a response time associated with that. You gotta be within 7 minutes of our station to get your truck, leave. The part-time, they have to be there anyway, so that response time is not, so saying that you have to work in Savage is not.
Just want to give you a different perspective on that too. So the city of Savage, we don't require, we still require a response to live within a certain area. For the pure fact that if we do that, and I have somebody that's from Anoka County and I need that secondary unit that doesn't exist in our operation, it's not there. So I really depend on our part-timers that still live in the area to staff that second station. It's just the performance on its timeline is significantly different. The more I go out to part-time where I don't have a requirement to respond back, the more I'm going to start calling upon the communities around me for mutual aid, which now I'm going to impact your communities and pull your services out of your community. So it's a trade-off.
I think I heard the comment that 80% of your calls are related to medical issues. Is that right?
It varies, but yes.
Trying to correlate two things here probably that don't go together. So each one of us has at least one, in a lot of cases, 2 or 3 fire stations in each of the communities, right? Is there any better way of utilizing the fire stations that we have and the capital expenses we're incurring to help address this 80%? Maybe I'm trying to put apples together with oranges, where it's a personnel problem, not a capital problem. But I'm curious whether the stations, which are an asset, can be better utilized.
Yeah, so I think, let me try. So let's look at Savage, right? We've increased our staffing. We don't staff both fire stations. So with us increasing our staffing for today, we've been able to reallocate some of our overhead. So we've reduced apparatus, everything else, because we have a different operational model. I no longer need people movers that cost me $1 million a piece. I just now minimize my fleet, maybe minimize my facilities, and put the staffing in it to manage that 80%. Did that cover that?
Yes, thank you.
So I was just going to make a comment, not so much a question, but you know, we had the tragedy last year in Burnsville with an EMS person dying. And I know that in Prior Lake, we now have body armor for our firefighters if they have to go to a call that involves an active shooter and so the discussion on they're not a fire department, they're emergency response staff. I think that is just something I don't think a lot of people necessarily understand.
Really, I'm happy you brought that up. So a lot of people ask us, well, why do we need police to go to that? Why do we need fire when police are already there? We all have our defined roles for that specific reason. Firefighters come into a scene, right? And we are focused on patient care, right? How do I improve the outcome of this patient and make a difference? We will walk past a weapon. We will walk past something that our law enforcement partners are trained, right? They're looking after our health and wellness when we're providing that care along with the patient. So that's why we go in tandem to a lot of these calls, because society just isn't as safe as it was in the 1970s. And again, the complexities of these calls, even if they're medical, are so much more elevated. We as the fire service, especially with these big gaps in our private ambulance services, we truly do need to focus on the patient outcome. I want our law enforcement partner there to make sure our crews are safe because of those incidents. And they're becoming more and more.
I have like 5 questions here, but I'm going to ask my short one. Because I'm in the district with Tom, and so Tom and I talk about this quite a bit. What are your thoughts in assessing those residents who could be considered, I would consider frequent flyers, and who are increasing the call volume in a greater proportion than the average resident? And what do you think would be the breakdown of what that would look like?
Do you want me like, so, yeah. So can you break me down from you, like what your classification is frequent flyers? It's somebody with high medical needs, high medical complexity, somebody that's not servicing their life safety systems or their alarms, and we're going back and forth to that. Can you just add some more context to that?
I can give you a great example. We have a what is it? Assisted living facility in our township. And over the last 18 months, they have created 45 calls just on their own. Vast majority of them, probably 90% of them, are lifts, because somebody falls out of bed, and they are actually precluded by state law from lifting themselves. They have to call the fire department to have them do that. To me, that is public money subsidizing a private industry. And so why shouldn't we be able to, and I know we can. And so I've already found that out. Township can assess, and we have to work with our fire department in order to get information and so forth. But outside of that, we have residents that probably maybe shouldn't be in their own home. I hate to kick anybody out, but we've had calls where somebody is calling the fire department because, hey, I hear a chirping in my house and I don't know how to turn it off. And they call the fire department. So it's that kind of thing.
Thanks for the clarity. I'll try to hit on some of this. So lift assist in a nursing facility. I'm all about root cause analysis. I think that has to be managed at the state level where they're getting their licensure, right? Like you need to make sure, I believe, that there has to be something in that licensure that you have to support staff to accommodate your patients. Now, anything outside of that, if it's a medical or an emergency that they need support, God forbid, we don't want you to hesitate, give us a call. When it's aging in place, right? So there's another way you can manage that. You can manage that one possibly like you do your false alarms for somebody that doesn't maintain their alarm system. Everybody in your community gets X amount of responses in that call type. Anything above that, if your community wanted to, you could assess a service fee. But that, I think you need to be careful because you need to spread that amongst all residents and businesses within your community. So that's a little bit of a slippery slope. And then also really making sure that we have a strong relationship with Scott County and their human services that if we're repeating these calls to these members that are aging in place, who do we put them in contact? And is there a possibility that we can leverage the services that already exist? I just don't think the fire departments in some communities know that those resources exist. And then how is it that we can actually activate it and get the support going?
Thank you very much. Round of applause for the panel. I appreciate everybody making time to be here, especially Chief Rinda. Chief Rinda is, if you didn't put this together, part-time fire chief in New Prague. So thanks for taking time out of your day to be here. Thank you, everyone.
It's just hard to.
Great information, great presentation.